So, a pleasant morning to each and everyone, especially to our clinical instructor, Ma'am Rachel. Good morning, Ma'am. So, we are the Group 2 reporters. So, we're here to tackle about our assigned topic entitled the eczema or dermatitis. So, by the way, I am Adele Tandoc, the first reporter. So before I move on to what is exactly the eczema, first let me discuss the histology and overview of the eczema. So the histology in this acute stage, edema in the epidermis or the spongiosis, progresses to the information of the intraepidermal vesicles, which may coalesce into larger blister or rupture. So when we say spongiosis guys, kay mao na siya ang hallmark sa epidermis in eczema. Ang causes ana kay allergic reactions such as sa medication or um, food. So the chronic stages of eczema show less spongiosis and the vesication but more thickening of the prickle cell layer, or which call the acanthosis, and the Horner layers, the hyperkeratosis and the parakeratosis. So this acanthosis guys means mo ni siya ang condition nga makakause sa area of dark, sticky, velvety skin sa body folds and creases. So kasagara makuan ni siya, mo affect ni siya sa armpit, sa singit or sa neck. Like kita na mo anang kuan kanang behind sa neck. I'm not saying here ha nga tanan nga kuan, like usually makita ni siya sa mga tambok bitaw nga tawo, like makita ninyo ang iyahang likod sa liog bitaw nga itom, mao na siya gitawag nga acanthosis. So na ako'y sample picture ana later sa next slide. So i-explain sa nako ang saning hyperkeratosis. So this hyperkeratosis, mao na siya ang patches of thick rough skin kasagara sa tiil na siya mo affect. So mura siya kuan like kubal sa tiil bitaw kanang gahi siya nga skin og dry. Nagya po na siya sample picture sa next slide. Unlike aning parakeratosis, mo na siya ang retention of the nuclei in the stratum corneum. So when we say stratum corneum, mo na siya ang the outermost layer of the epidermis. And also the variable of degree of the vasodilatation and the infiltration with lymphocytes. So, mao na siya ang sample pictures. So, mao na akong giingan ganina, that's the sample picture of the acanthosis. Na siya behind sa neck sa tao. So, ang hyperkeratosis sa tiil, and then mao na siya ang parakeratosis. So let's move on to the overview of the eczema. So although eczema is considered to be a general term, eczema is the name given for any form of dermatitis or itchy rash. So katol jud kay na siya ang eczema. So according to the National Eczema Association, many children live with the chronic skin condition that often is developed during childhood. Caused by a flaw in the immune system, eczema affects 10 to 12% of children. So lucky for most children, eczema tends to improve and often go away for the majority of the children that are diagnosed with it. So kaning eczema kay wala ni siya gipili nga ages ha. So very common din ni siya sa mga all ages, like mabata man ka or tiguang, pero most common din ni siya sa during pagka-childhood. Pero muhawa ra pud ni siya if imong i-cure bitaw, like mobutang kag treatment sa imong eczema or dermatitis. So, what is exactly the eczema? This eczema is a skin condition characterized by inflammation, redness, and itching. So, pula ni siya sa kuan, like if na kay red spot diya mo na siya ang gitawag nga eczema, either unsa na siya nga kind of dermatitis, so very kuadyo ni siya nga nang katul kayo. So it is a chronic condition that can come and go over the time, so mawala ra ni siya then mubalik ta pod. Eczema can affect people of all ages, as I said earlier, like all ages yun siya. So, but it is often starts in childhood. The exact cause of eczema is unknown, but it is thought to be related to a combination of genetic and environmental factors. So, when we say environmental factors, like kana bitang imuhang palibot, like kanang gubot or hugaw ang imong palibot, dali ra jud ka maapektuhan og eczema. So there are several types of eczema, including the atopic dermatitis, contact dermatitis, dysdrotic eczema, and the nodular eczema. So kaning several types of eczema kay madiscuss ni siya sa ako ang next nga madiscuss na siya sa akong ka-group ang mga several types of eczema. But the most common form kay ang atopic dermatitis jud kay often associated with other allergic conditions like asthma and hay fever. So these eczema symptoms can vary but often mag-include siya dry, red, and itchy skin, rash, swelling, and rough patches. So makita natin mga sample pictures anong mga several types of eczema later on sa mga next slide nga ma-report sa akong kauban. So mo na siya ang very common symptoms sa eczema, like katul jud kay na siya, then red, then dry. So if once gali nga ang itching man ang most intense man jud, if once natay dark red spot sa to ang lawas bitaw nga katulon na to, then mo din na siya ang maka-cause og scratching, like masamad na dayon na siya. Then with this situation, this can go on further irritate the skin and lead to infection. So magkalala na din na siya. So for the cure of eczema, be reported by Miss Macapodi.
So how will you cure eczema? So there are lifestyle changes that can help manage eczema symptoms, and this includes avoiding triggers such as certain soaps or fabrics and keeping the skin moisturized. Some people may also find relief from alternative therapies such as herbal remedies or kaning acupuncture. So if you're a person nga na eczema, kay you need to avoid things nga maka-trigger sa imong eczema like kanang soaps or fabrics nga nag-contain og mga certain chemicals nga trigger sa imong eczema, and also keep the skin moisturized. And some of this also ay like sa pag-exercise kanang mag-sweat ka, and also sa food sad or kanang mga chemicals like lotions nga you put on your body, and also like kanang kuan pod stress pod maka-trigger pod na siya eczema. So ang eczema kay mag-take siya 2 to 3 days before mugawas ang signs sa imong eczema. So example, kaning nag-binge ka og kuan, mag-eat og sugar. So mag-take siya 2 to 3 days before nimo makita nga na-trigger or nigawas na imong eczema. So ang first nimo abuhaton is kanang remove imong i-remove or mag-reduce kag take og kanang sugar sa mga food nimo ginatake, and also mag-minimize ka sa kanang imong skin nga ma-expose sa mga soaps or kaning mga detergents, and also kanang after nimo maligo kay kuan you kanang mag-apply ka detso og kanang mga moisturizer. And lastly kay in cold weather kay kuan mag-use ka gloves. So why sugar kanang nganong big factor man ang sugar sa eczema kay kuan, because ang sugar man god kay maka-increase siya inflammation sa imong skin. So eczema, most people are able to effectively manage their symptoms and lead normal lives with proper treatment and care, and it is important to consult a healthcare professional for a diagnosis and appropriate treatment plan for eczema. So if nakay kuan eczema kanang best jud nga moadto kag healthcare professional para ma-diagnose ka kung what type of eczema you have and mahatagan ka kanang proper nga treatment para sa imong eczema. Teaching modification. When considering any teaching modification or changes you might have to make in a classroom with a child that suffers from eczema, it's important to think about steps a child can take to manage their condition. And it is important to remind the student of the importance of not scratching if you notice them doing so, and keep the child in a safe environment to manage their condition. So, first thing mo button is, of course, mag-discuss ka sa everyday nga treatment or avoidance sa sa mga environment na maka-trigger sa eczema sa child, like overheating, rough prickly materials, and ensure a regular and ongoing use of moisturizers and eczema baths. So give guidance on eczema plans, treatment plans. So possible treatment for eczemas are like moisturizing. So kapila na ni siya na-mention ganiya. So very important during ang pag-moisturize ang skin regularly with creams, ointments or lotions that are fragrance-free and hypoallergenic. Maka-help man gud ni siya og kaning maka-prevent siya og dryness og itching, and maka-help pud siya improve sa imong skin barrier. Um, the next one is avoiding. So triggers that can worsen your eczema, such as irritants like soaps, detergents, perfumes, and allergens like pollen, dust mites, pet dander, and also stress, extreme temperature, and sweating. Third one is kanang kuan, puwede sad ka kanang mag-apply og mga medicated products sa affected areas sa imong skin, such as mga corticosteroids, calcineurin inhibitors, or biologics. Maka-help ni sila og reduce sa inflammation, itching, and skin damage. And kaning they are available in different strengths and forms. Magdepende siya sa imong age and type and severity sa imong eczema. You should, and also kanang dapat you should follow your healthcare provider instruction on how to use them safely and effectively. The fourth one is taking oral medication. Makahelp pud ni siya og control sa imong eczema symptoms, such as mga antihistamines, antibiotics, immunosuppressants, or anti-inflammatories. And usually gina-prescribe ni sila sa mga moderate to severe cases or when other treatments are not enough. Naapod ni sila kuan side effects, so you should always consult your healthcare provider before taking them. And last one is trying a phototherapy or light therapy. Mag-involve din siya exposing your skin to control amount of natural or artificial lights, and makahelp pod ni siya improve sa imong skin conditions, and maka-reduce ni siya og needs for medications. So the types of eczemas are contact dermatitis, atopic dermatitis, seborrheic dermatitis, napkin dermatitis, nomular dermatitis, perioral dermatitis, pemphigus dermatitis, and gravitational dermatitis. So we have contact dermatitis. So contact dermatitis is an inflammatory reaction of the skin to physical, chemical, or biologic agents. The epidermis is damaged by repeated physical and chemical irritations. The contact dermatitis may be due to irritants or allergens, and it constitutes 80% of dermatitis cases. Mostly industrial and usually on hand and forearm. So ang contact dermatitis kay usually kay sa hand ra siya ug sa forearm, then acute reaction elicited after brief contact. Commonly be detergents, alkalis, and solvents. So ang treatment for contact dermatitis is steroid creams or ointments. These are applied to the skin to help soothe the rash, and you might apply prescription topical steroids such as clobetasol 0.05% or triamcinolone 0.1%. And always talk with your healthcare provider about how many times a day to apply it and for how many weeks. And we also have pills In severe cases, your healthcare provider may prescribe pills you take by mouth, so oral medication, to reduce swelling, relieve itching, or fight a bacterial infection. So, mo ni siya ang contact dermatitis. Kana siya, mura siya kuan, ang gi-pack sa lamok, pero tagan siya din, bumps. And itchy siya and red, na siya redness. So, magswell imong kuan. There are mga bumps nga kuan, nagkuan sa imong hands. And clinical manifestations for contact dermatitis is the eruption begin when the causative agent contacts the skin, and the acute phase includes itching, burning, and erythema. It's followed closely by edema, papules, vesicles, and oozing. And in the subacute phase, these vesicular changes are less marked and they alternate the crusting, drying, and fissuring, and also peeling. So, if repeated reaction occur, if the patient continually scratches the skin, lichenification and pigmentation occur, and secondary bacterial invasion may follow.
Where does dermatitis form on the body? The location of your dermatitis depend on the type. For example, atopic dermatitis can appear anywhere on your skin. But in teens and adults, it's typically on the hands, elbows, inner elbows, neck, knees, ankle, feet, and around the eyes. So, atopic dermatitis, that is the condition of dry skin, itchy, and inflamed skin. Then, people with atopic dermatitis are risk of developing food allergies, high fever, and asthma. So, like what Tandoc said earlier, nga wala siya ginapili nga age like mapa-teens or adult man na. So, atopic dermatitis often begin before the age of 5 and may continue into the teens and adults. Atopic dermatitis symptoms can appear anywhere on the body and vary widely from person to person. So, seborrheic dermatitis and candle cap are typical on your scalp and face here. So, seborrheic dermatitis doesn't cause hair loss. However, scratching can injure your hair follicles, resulting in some hair loss or dandruff. So, seborrheic dermatitis kanang inigkutkot nimo sa imong ulo, then that can cause dandruff or hair loss. Then periapical dermatitis is found around your eyes, mouth, nostrils, and sometimes the genitals. Per- Perioral dermatitis, if you have a red rash around your mouth, you might have a type of dermatitis called perioral dermatitis. Your skin might be scaly and flaky with inflamed bumps that can itch and burn. Sometimes the rash spreads to the nose and eyes. So in the word perioral, peri means around the and the oral means mouth. The word literal means around the mouth. So perioral dermatitis is easily recognized with the location of the rash around your mouth. It can also go your eyelids or around your eyes and nose. Medical management, the objective of management are to rest and involve skin and protect it from the further damage. A detailed history is obtained, and offending irritant is removed. Local irritation should be avoided and soap is not generally used until healing occurs. Rest and liquid application, non-steroidal preparation, daily 10 minutes means 10 minutes soak in cold 0.65% aluminum association, saline or tap water and soap followed by the smear or corticosteroid cream or lotion.
So, good morning, ma'am. Good morning, everyone. I'm Limgas Norhanifah, the next reporter. So, next is potassium permanent. Calamine lotion with drop drenching, especially in children, about followed by steroid application covered with double layer of tubular dressing. systemic corticosteroids, and antibiotics in case of extensive contact dermatitis. So next is atopic dermatitis. Means without place in Greek. It's a state in which exuberant production of IgE occurs as a response to common environmental allergens. Atopic patients develop one or more of atopic diseases as asthma, high fever, and food allergies. Cardinal feature aging, lubrication of dry, xerotic skin, restoration of skin barrier function. Topical immunomodulators, pimecrolimus, tacrolimus. Corticosteroids, phototherapy for severe inflammation and pruritus, reduction of stress, reduces flares, antibiotics for secondary infection as needed. So, ang atopic dermatitis, often referred to as eczema, is a chronic, long-lasting disease that causes inflammation, redness, and irritation of the skin. It is common condition that usually begin in childhood. However, anyone can get the disease at any age. Atopic dermatitis is not a contagious, so it cannot be spread from person to person.
So treatment, moisturizers. Regularly apply fragrance-free moisturizer to keep the skin hydrated. This helps in reducing dryness and itchiness. Corticosteroids. For more severe inflammation and itching, topical corticosteroids may be prescribed by a healthcare provider. Topical calcineurin inhibitors. These medications, such as tacrolimus and pimecrolimus, are applied topically to suppress the immune response and reduce inflammation. Antihistamines. Non-sedating antihistamine can be used to help alleviate itching and improve self. Wheat drop therapy. In some cases, wheat drop therapy may be suggested. This involves applying wheat dressing over moisturizer or medication to enhance hydration and absorption. Avoiding triggers. Identify and avoid triggers that may worsen symptoms, such as certain fabrics, hard soap, or specific allergens. Seborrheic dermatitis. Common eczema of the hairy areas show characteristic greasy, yellowish scales. May be red scaly exudative or dry scaly. A fake scalp, ears, eyebrows, face, presternal area, armpits, umbilicus groin.
So good morning everyone. So my assigned topic is all about the treatment of seborrheic dermatitis. So the first is antifungal shampoos. For the seborrheic dermatitis on the scalp, medicated shampoo containing antifungals, agents like the ketonazole, selenium sulfide, or pyritation zinc are often recommended. Next is the topical corticosteroid. Ano siya ang mga meld, meld. Low to mild potencies topical corticosteroid cream or lotion may be prescribed for the short-term use to reduce inflammation and itching. Next is the topical antifungal creams. In addition to antifungal shampoos, topical antifungal creams or ointment containing ingredients like ketogenol or cephaloperoxide may be applied to affected skin area. Next is antifungal gels or foam. Some individuals may be benefits from antifungal gels or foams, especially for areas with hair as they are easy to apply to skin and scalp. Next is sunlight exposures. A moderated sunlight exposure can sometimes help improve symptoms, but individuals should protect their skin from excessive sun exposure. Next is the prescription of medication. In case of severe seborrheic dermatitis, a healthcare provider may be prescribed
oral antifungal medication or other systematic medication to manage symptoms. Mao ni ang example sa seborrheic dermatitis. Napkin diaper dermatitis, irritate in natures aggravated by waterproof plastic fans, feces urine, moist erythema of napkin area sparing skin fold, and candida superfiction is common. So, kadalasan nagkakaroon nito ang mga bata dahil hindi agad napapalitan ng diaper or kaya nakakaroon ng mapupulang marks sa puwet o kuan, na-expose ng matagal yung ihi sa skin.
Good morning to each and everyone. So I am Amira Datugan. I will be tackling about the treatment. So what is the treatment of any kind of different kinds of eczema? So these are the frequent diaper changes. So change diapers frequently to minimize prolonged exposure to urine and feces. This is one of the most crucial steps in preventing and treating diaper rash. So gentle cleansing. Clean the diaper area with gentle wipes or a soft cloth. Avoid wipes that contain alcohol or fragrances as they can be irritating. Barrier creams or ointments apply a thick layer of a barrier cream or ointment, such as zinc oxide or petroleum jelly to create a protective barrier between the skin and moisture. Hydrocortisone cream under medical supervision. In some cases, a mild over-the-counter hydrocortisone cream may be recommended by a healthcare professional to reduce inflammation. However, this should be only be used under their guidance. The next one is consult a healthcare professional. If the rash persists, worsens, or is associated with other symptoms, consult a healthcare provider for further evaluation in or another underlying issue. So, frequent diaper changes. It is crucial jud siya nga step for preventing or treating diaper rash. Because other reporter said earlier na kanang crucial siya nga mag-change kay it's because ang urine or ang other kanang masalo sa diaper is hugaw jud siya. And then the next one is gentle cleansing. So mag-avoid ta nga mag-use og wipes kay it's because ang wipes is dili tanan kanang makauyon sa kanang ingredients or other mga gipang gamit na makasamot or maka-irritate siya sa skin sa usa ka person na nay allergies. So barrier creams or ointments. So for example like katong mga eczema nga mga nagsakit is ay mga nitubong nga sakit is ano pa siya matreat pa siya isa ka ointment or other like for example sa petroleum jelly butangan ninyo siya para mas malesen siya or mas maulian siya. And then the hydrocortisone cream is under medical supervision. So mo ni siya ang pang-reduce sa sa mga hubag-hubag. And then the consult healthcare professional, so it's sabotable naman na mag-consult jud ta sa tong health provider if in case dili na siya molyan sa tong mga treatment na gipangbuhat. So these are the example of the napkin diaper dermatitis if dili ninyo siya ma-change. Labaw na sa mga bata. Okay, so nomular dermatitis. What is nomular dermatitis? Also known as discoid eczema is a type of dermatitis characterized by coin-shaped or oval lesions on the skin. So, kabanday mo anang kanang mura siya og ringworm. Inana ang iyahang kan. So the next slide is will be kanang showing the example of anomular dermatitis. So I will be continuing to read this slide. So the term nomular comes from the Latin word nomus, meaning coin. So mo na siya ang image ninyo makita is circle siya, ringon siya pag inyo siyang katulon itchy jud kay na siya guys, and then pag inyo na siyang sobrang katol is the more na siya magkadako. So these lesions are often well defined, round or oval in shape, and can vary in size. So the exact cause of nodular dermatitis is not fully understood but is believed to be related to a combination of genetic, environmental, and immune system factors that may trigger or worsen nodular dermatitis include dry skin, exposure to irritants, changes in temperature, and stress. So, as what I've read this slide is the exact cause is wala jud siya, not fully na masabtan na to siya kung asa siya gikan nakagaw, but um na matrigger siya or makakuha mo ani nga sakit by the environment. So for example, pag dry inyong skin or wala tay proper hygiene, makakuha jud ta aning nodular dermatitis. So it is important for individuals with suspected nodular dermatitis to consult with the healthcare professionals such as dermatologists for an accurate diagnosis and appropriate treatment plan tailored to their specific situation. So, muna na siya, ang pasabot niya is, mag-proper hygiene ta. Okay, so, okay. So, muna siya ang sample sa nodular dermatitis. Muna siya, napalabian na siya siguro o katol. And then, magkalala na siya.
So good morning everyone. For treatment, topical corticosteroid creams or ointments are often prescribed to reduce inflammation and itching. The strength of the corticosteroid may vary depending on the severity of the lesions and the location on the body. Topical corticosteroids are steroid preparations that are applied directly to the skin. They are used to treat a wide variety of skin conditions and work by reducing inflammation, making the skin less red and itchy. It is important to remember that topical corticosteroids come in different strengths. Stronger steroids tend to be used on the body, while weaker steroids are used on the face and skin folds. They come as ointments or creams. Steroid ointments are oilier and are therefore better for treating drier skin. For emollients and moisturizers, regular use of emollients and moisturizers helps keep the skin hydrated, reducing dryness and preventing new lesions from forming. Most people, especially those living with dry skin conditions like eczema, already have a sense of what emollients are. Emollient is a moisturizer which helps to rehydrate the skin by forming a layer over the skin, and it prevents water loss, and this allows skin to repair itself. Wet therapy involves applying wet dressing over medicated creams or emollients to enhance moisture retention and absorption. This can be beneficial especially during flares. Wet wraps are elasticated material. They form a protective layer over the skin and prevent further damage from scratching. Wraps are mostly common use with emollient creams underneath, although they can be used with topical steroids for a short time. Prescription medication. In more severe cases, a healthcare provider may prescribe oral corticosteroid or other systemic medications to control inflammation. However, systemic medications are generally reserved for short-term use due to potential side effects. Anti-age creams, over-the-counter or prescription anti-age creams containing ingredients like pramoxine or menthol may provide relief. So, perioral dermatitis. This form primarily affects the face, especially around the mouth, eyes, and nose. It is characterized by red bumps and pustules, and the exact cause is not well understood. Although the perioral region is the most common area of distribution, this disease is this disease also can affect the periocular and paranasal skin. For this reason, it is often referred to as periorificial dermatitis. Perioral dermatitis commonly affects young adult females 20 to 45 years of age. However, perioral dermatitis commonly affects young adult females 20 to 45 years of age. However, it also has been reported in children. There is no significant difference in frequency of perioral dermatitis among gender or race, and pediatric populations. The symptoms of viral dermatitis can vary depending on the type and severity but often include redness, itching, and skin rash. Although it is usually found around the mouth, perioral dermatitis can also move to your eyelids or around your eyes and nose. It can also appear on your genitals, scalp, ears, neck, extremities, and trunk. Um, Treatment may involve identifying and avoiding triggers, using topical creams or ointments, and in some cases, oral medications. It's essential to consult with a healthcare professional for an accurate diagnosis and appropriate treatment plan. Uh, Perioral dermatitis might flare up after you stop a topical steroid. Some experts recommend going back on a topical steroid that is not as strong as what you may be using, so you have to discuss this matter with your healthcare provider. There are several medications that can help your perioral dermatitis. Unfortunately, this medication may not fix the problem for weeks or months. For treatment, uh, stop fluorinated dental products and topical corticosteroids if being used, and then use topical antibiotics. So, mao ni siya ang kuan. Example sa perioral dermatitis.
Okay, so let's proceed to fomfolic dermatitis. So, what is fomfolic dermatitis? So, fomfolic is also known as dyshidrotic eczema. This skin condition is characterized by intensely itchy blister that develop on the edge of the fingers, toes, palms, and the soles of the feet. It can be temporary condition or in some cases is more persistent. So, pwede itong magpatuloy. So, ito ay kadalasang nakikita na may mga palto sa paligid ng palad ng isang tao at sa ibang pagkakataon, ang talampakan ng paa ng isang tao ay maaring maapektuhan din. So, the cause is usually unknown but sometimes provoked by heat or emotional upset or small amount of nickel in food, subject allergic to nickel. The vesicles are not plugged sweat ducts. So wala siyang eksaktong dahilan para sa kondisyong ito, ngunit maaaring naugnay ito sa kabilang allergy naugnay ito sa mga kondisyong allergy tulad ng high fever. Ang mga kadahilanan sa peligro na nauugnay sa fomfolics ay kinabibilangan ng stress, pagkakalantad sa metal, at pagkakaroon ng sensitibong balat. So, presentation and course. It is trisome and sometimes very unpleasant for eczema. Recruit bouts, vesicle or larger blister appears on the palms, fingers, and or the soles of adults. Bouts lasting a few weeks recur at regular interval. Secondary infection and lymphangitis are recurrent problem. So investigation, sometimes fomfolics like eruption of the hands can follow acute tinea pedis. Swabs from infected vesicles should be cultured for bacterial pathogens. So skin swabs are sometimes required if antibiotic treatment is not proving effective in apparently infect hand dermatitis. Skin scraping for microscopy and fungal culture may be necessary to rule out dermophyte infection. Patch testing should be carried out in chronic cases or in there is suspicion of specific contact allergy. So in treatment, as with eczema, there is no absolute cure for fomfolics, but it does respond to treatment. Ang possible treatment for fomfolics are aluminum acetate or potassium permanganate soaks followed by applications of very potent cort- corticosteroid cream are often helpful. And appropriate antibiotic should be given for bacterial infection. So, mao ni siya ang picture sa fomfolic dermatitis.
Since wala si Mangunda, okay, umana na daw siya og report. So, for the last several types of dermatitis is the gravitational dermatitis. Because of this is the pure circulation, often accompanied by the obvious venous insufficiency. The presentation and the course are chronic patchy eczematous condition of the lower legs, sometimes accompanied by varicose veins kanang kuani siya diri na siya part sa likod sa tuhod bitaw like sa varicose veins, edema, and the hemosiderin deposition. When severe, it may spread to the other leg or even become generalized. The complication of this gravitational dermatitis is sensitization of local antibiotic applications rather, or to the preservatives in the medicated bandages, and also the ulcer. So for the treatment of this is the elimination of the edema by elevation, pressure bandages, or diuretics. So a moderately potent topical steroid by may be helpful, but stronger ones are best avoided. The blend application examples like the laser space or the zinc cream BNF or the medicated bandages. It is also liable to persist despite of surgery when the underlying veins. So, mo ni siya ang sample picture of the gravitational dermatitis. Usually, makita jud nato ni siya kasagar sa mga nanabitoy edad like sa mga tigulang. So that would be all the last part of our report entitled the eczema or dermatitis. Thank you.